So my name's Erica Auger, and I am the Clinical Manager for Behavioral Health at Spectrum Health Medical Group, and I manage a team of social workers who are embedded in primary care. Today, we're going to talk a little bit about integrated behavioral health and how to use your new behavioral health specialist as part of the care team and how to integrate them into your office and into your workflows. The medical group has used a framework for integrated behavioral health called PBM Plus, or Psychiatric Behavioral Medicine Plus. And there's 3 steps to PBM Plus. One is universal screening for behavioral health conditions. So we'll talk more about that later in terms of the tools that we use and how that works with behavioral health integration. Care triage, so understanding what do patients need. And last is interventions. So making sure that we have improved access to psychiatry and psychotherapy, and also systematic case review. Again, we'll talk about this later on. So PBM Plus, or Psychiatric Behavioral Medicine Plus, is often represented with an inverted triangle. Again, that first step in our framework or model for integrated behavioral health is screening. It's the largest part of the triangle because we're universally screening every patient at every visit. Care triage is the next step in our 3-step process, and care triage really represents the assessment of need for patients who screen positively for depression and anxiety back in step 1. And then our last step is interventions. It's the smallest part of the triangle. And those interventions really, again, are for patients who are screening positive for depression and anxiety. And again, can include providing improved access to PBM services, systematic case review, and engagement with your behavioral health specialist. So the behavioral health specialist plays an important role in the integration of behavioral health into primary care. You now have additional support for your patients who have been identified to have behavioral health needs. So using the PHQ-4 as a pre-screening tool, we're screening patients for depression and anxiety. For patients who are positive on the PHQ-4, additional screening is done using the PHQ-9 for depression and or the GAD-7 for anxiety. A score of 10 or more is a good indicator that your behavioral health specialist might want to meet and be involved with that patient. So we do ask providers to use 10 as a threshold for referral to behavioral health. And anytime we can, a warm handoff is appreciated. For patients, it's nice to be able to meet the social worker right on the spot. That helps us ensure that the patient comes back for an assessment later on. So universal screening is one of the mechanisms by which your office will identify patients who are appropriate to see your behavioral health specialist. But it's not the only way to identify patients who might benefit from a social work intervention. As you can see here, there's a long list of other reasons that a referral to your behavioral health specialist might be triggered. So other reasons you might make a referral to your behavioral health specialist include verbal, emotional, or physical abuse, substance use disorder, any displays of high emotional acuity in the office, so crying, anger, apparent anxiety, a patient who's fidgeting or seems nervous, a disclosure of a mental illness that's not captured by the screening tools. So if you recall, we are screening for depression and anxiety, but you may have patients who come to the office and disclose a history of bipolar disorder, schizophrenia, or any other mental illness. Again, those would all be good reasons to include your behavioral health specialist in the care of that patient. And lastly, any concerns about basic needs, housing, food, transportation. Basic needs, again, are another reason you may want to include your behavioral health specialist in the care of a patient. Once a behavioral health specialist becomes involved with a patient, what can you expect as a provider and what can the patient expect? The behavioral health specialist will start by completing a comprehensive biopsychosocial assessment to understand what the patient's needs are and to partner with the patient to establish goals of care. The behavioral health specialist may engage in brief psychotherapy with the patient, generally around 3 to 5 sessions. The behavioral health specialist may provide education, resources, referrals to other community agencies, medication monitoring, relapse prevention planning, and finally, systematic case review. Systematic case review is a unique opportunity as a provider to receive psychiatric consultation for patients who have needs for psychotropic medications. So on a weekly basis, the behavioral health specialists participate in a consultation meeting with our psychiatrists. They have the opportunity to present patients for review by the psychiatrist and recommendation for medications. The BHS will present the patient's presenting problem, any comorbidities, history, medication trials, any relevant information that the psychiatrist may need to review the case and provide recommendations. The BHS will document the recommendations in EPIC and route to the primary care provider for a review. As the primary care provider, you are still in charge of the patient and treatment because you will actually write the prescriptions. Patients can be presented multiple times as appropriate in systematic case review, and we can continue to review their case, their medications, and provide medications until the patient is stable. So for a provider, you now have many reliable team members to help you, not only your behavioral health specialist, but access to psychiatric consultation. So who's appropriate for systematic case review? So generally, patients with one or more of the following factors may be appropriate for systematic case review. So patients who've had multiple medication failures, patients who have complex comorbidities, patients with co-occurring mental illness and substance use disorder, and those patients who have a diagnosis of severe and persistent mental illness. So in summary, you now have a new resource to help you treat patients holistically. So your behavioral health specialist can help you support patients by helping to identify and assess behavioral health concerns while improving access to PBM services and interventions.